Hi students, welcome to Angel Health Academy. Topic for the day or topic for the session is IPHS 2022 for Primary Health Center. Indian Public Health Standards 2022 for Primary Health Center. I have already uploaded a video regarding IPHS for Sub-Center, that is Indian Public Health Standards 2022 for Sub-Center. If you have not watched this video, please go through that and watch this video and you will get a clear-cut idea about the basic of IPHS 2022. Okay, many sections are same in sub-center, primary health center, even community health center. So when you watch sub-center at first, you will get an overall idea about the IPHS 2022. So now let us talk about Indian Public Health Standards IPHS 2022. So Ministry of Health and Family Welfare revised IPHS guidelines in 2022 for the district hospital and the sub-district hospital, that is for SDH and DH, and for the community health center and PHC after Ayushman Bharat, it is known as Health and Wellness Center. So Health and Wellness Center or Primary Health Center, and Health and Wellness Center, that is Sub-Health Center or Sub-Center. So IPHS 2022 is the guidelines or standards for sub-health center or sub-center, primary health center, community health center and sub-divisional hospital or sub-district hospital and district hospital in India to render the quality services. Then sections of IPHS 2022. So when you go through in depth of the IPHS standards 2022, we will see 8 important sections. So IPH guidelines have been uniformly framed with 8 sections. So all the IPHS standards, even in sub-center, primary health center, then community health center, sub-divisional hospital and district hospital, we have 8 sections. Okay, those 8 sections are, first one is they have written about the background of the IPH standards, then introduction of the topic, for example, why it is revised for the sub-center and what is the reason. Okay, introduction, then objectives of health centers, that is key objectives, and fourth one is types or categories of the health centers. So classification of health centers, then population norms or population coverage of that particular health center, then general principles has to be followed by the health centers, then criteria for compliances to maintain the standards in an actual setting. What are the criteria has to be followed by the health centers, that is criteria for compliance, and what are the different services is provided and infrastructure must be available in the particular health center to maintain the quality health services. Thus there are 8 sections in the IPHS standards 2022. Then after that we have 12 different annexures related to the IPHS guidelines 2022 of the particular institution or health center. Now let us talk about in detail about Indian Public Health Standards for Primary Health Center. Okay, so first one is section 1, that is background. Okay, section 1 is the background. In background it is describing or it is explaining about the, or it is briefing about the journey towards the global strategy achievement or global action plan, that is towards health for all and even towards universal health coverage UHC. Okay, so in the background session it is briefing about the journey of the government of India to achieve the global strategy or goals of the health for all and universal health coverage. And even the background also consists about the reason for why IPHS Indian Public Health Standards are required or needed in strengthening the health centers, health and wellness centers in India. Okay, these are the 2 important aspects are discussed in the background of IPHS 2022. Then second section is regarding introductions. Okay, introduction includes the rationality behind the revising the IPHS. So it was started in 2007, then first revision was on 2012 and later it is 2022. So why it is revised? So rationality, the scientific principles or rationale or reason for revising the IPHS Indian Public Health Standard is given in the introduction part of the IPHS section 2. Then it briefly describes how IPHS can accelerate India's progress towards achievement of UHC and sustainable development goals in align with the national health policy. So in the introduction part, it is also explaining or it is also describing a brief about how IPHS can increase the progress of India in achieving the universal health coverage and sustainable development goals in line with or in relation to or in association with the National Health Policy 2017. So you know that Government of India revised National Health Policy. The latest policy is 2017. With this policy, how to achieve the goal of the UHC and Sustainable Development Goal, also explaining or describing briefly in the introduction part of the IPHS 2022. Section 3 is key objectives of IPHS 2022. So section 3 explaining about the key objectives of IPHS for the health centers. That is for the sub-centers, primary health centers, community health centers, even district hospital and sub-district hospital. So section 3 is key objectives. So there are 6 important or 6 key objectives explained in this session or section 3. The first objective is to define uniform benchmark. So the first objective is to define uniform benchmark. So define uniform benchmark means uniform or similar standard of quality services from all the health centers in our country. Okay, so all the health and wellness centers in the country provide a uniform or similar quality services. That is called benchmark, quality services. Okay, so first key objective is to define uniform benchmark. Second objective is to specify the minimum assured and achievable services. So in all the health centers, health and wellness centers in India, as per the IPH 2022, there are essential services and desirable services. So in this key objective, it is explaining or it is specifying what are the minimum assured services in the sub-center, primary health center and community health center. Like that, all the health center, what are the minimum assured services and what are the desirable services can avail by the public. So that is the second key objective, to specify the minimum assured, essential and achievable services, that is essential and desirable services. Third key objective is to provide guidance on health system strengthening components. So there are many components or many aspects to strengthen the health system. So IPHS 2022 provided guidance to all the health centers, health and wellness centers in India, that is sub-centers, primary health center, community health center, to strengthen its services. Okay, strengthen its quality and comprehensive services to the public. Okay. Then the fourth key objective is to achieve and maintain an acceptable standard of quality care. So all the health center has to compliance with the IPHS 2022. So they have to render an acceptable standard of quality care. So IPHS 2022 helps all the health centers in India to achieve and maintain or sustain an acceptable standard of quality patient care. Then fifth key objective is to facilitate monitoring and supervision of the facility. So IPHS itself is a guideline or it is a tool. So with that we can monitor and we can evaluate the services which is rendered by the all health and wellness centers in India. So it helps to monitor the health services, quality health services. At the same time it helps to supervise the health services rendered by the health center. So it provides the facilities both for monitoring, continuous monitoring and supervision of the quality health services in the different health and wellness centers in India. The sixth key objective is to provide guidance and tools. So of course IPHS 2022 provided the guidance for to render the essential and desirable services, quality and comprehensive services. So it provides the guidance. At the same time it is a tool or it is a quality assurance tool. With that we can evaluate the services rendered by all the health centers in our country. So the last key principle, sixth key principle is to provide guidance and tools. So these are the 6 key objectives of IPHS 2022. It has been explained in detail in section 3. So next is section 4. Section 4 is types or categories of health wellness centers. Types or categories or classification of health wellness centers. Okay. Primary health center under Ayushman Bharat is converted or modified or renamed as Health and Wellness Center, Primary Health Center. So name of the center according to IPHS 2022, the Primary Health Center is named, or under Ayushman Bharat, it changed its name as Health and Wellness Center, Primary Health Center, HWC PHC. Okay. types or categorization of this health and wellness center, primary health center. In rural area, it is called as health and wellness center, primary health center. In urban area, there are two primary health center. One is health and wellness center, urban primary health center. Then second is specialist urban primary health center or polyclinic. Okay. It is a group of multiple or number of clinic that is called specialist urban primary health center or polyclinic. So classification of primary health center is classified according to the area, that is rural area and urban area. In rural area, the primary health center is known as health and wellness center, primary health center. In urban area, there are two primary health center. One is health and wellness center, urban primary health center, and the next one is specialist urban primary health center or polyclinic. Then third point is the population norms of the primary health center. Okay, in the rural area, health and wellness center, primary health center, if it is situated in the general or in the plain area, it covers a population of 30,000. Okay. So, health and wellness center PHC in rural area, in the plain area or general area, cover a population of 30,000, and hilly, tribal, other backward area, it covers only 20,000. So, health and wellness center, primary health center in the rural area, if it is belongs to in the hilly area, tribal area or backward area, then it covers only 20,000 population. Then population coverage of health wellness center urban PHC is 50,000. That is HWC UPHC covers a population of 50,000 and specialist UPHC or polyclinic cover a population of 2.5 lakh to 3 lakhs. Okay. 2,50,000 to 3 lakh population. Okay, this is about the categorization and the population norms of primary health center as per the section 4 IPHS 2022. The next is section 5. Section 5 is bed requirement at the primary health center. Okay, here I have mentioned RPSC, that is nothing but rural primary health center. UPHC you can consider as urban primary health center. Then according to the number of hours a PHC function, it is called as 24/7 PHC and 24/7 UPHC. 24/7 means 24 hours into 7 days. 7 days of the week it function for 24 hours. That is a round the clock functions. Okay, that is 24/7 PHC and 24/7 UPHC. Okay, so E and D, you can see that E is essential and D is desirable. Okay, essential is a mandatory, it must be there. Okay, so in the rural primary health center, that is health and wellness center, primary health center, essential bed is 2 bed. Okay, 2 bed is very essential in the rural primary health center, and desirable, that means it can even have a maximum 4 beds. That is 2 to 4 beds. Okay, in rural primary health center. Then in urban primary health center, essential bed requirement is 2 only, that is 2 daycare beds. Okay, essential is 2 daycare beds and desirable is 4 daycare beds. So that also 2 to 4 beds. Okay, essential 2 and desirable 4 beds. But in 24/7 hours PHC or 24 hour into 7 hours UPHC, essential bed requirement is 6 beds and desirable is 4 beds. That means 6 plus 4, 10 beds. Okay, so minimum 6 and it can be even 10 beds. Okay, essential 6 beds and desirable 4 beds. So that is about the bed requirement at primary health center in rural area, urban area, and even if it functions 24/7 hours. Okay. Then section 6 is general principles. Section 6 is general principles of health wellness center. Here the first principle is health wellness center, primary health center and health wellness center, urban primary health center both provide comprehensive primary health care services. So people may avail comprehensive primary health care services. Okay, that is the 12 parts of the or 12 components of the comprehensive primary health care services. Okay, I have already uploaded a video about comprehensive primary health care services. Then polyclinics provide ambulatory specialist services. So it is a group of clinics in a single setting. Okay, so it provides ambulatory specialist services in the urban areas. Okay, so first principle is health wellness center, primary health center and health wellness center, urban primary health center provide comprehensive primary health care services to the public. Then polyclinic provide the ambulatory specialist services in the urban area to the people or public. Section 7 is criteria for IPHS compliance. Compliance is nothing but action. So criteria for IPHS action. So for any public health facility or public health authority or health centers to be considered as in compliance with the IPHS norms or they are following IPHS rules and regulation and guidelines, they should have a minimum standard. So these are the 5 minimum standard or criteria for IPHS action or IPHS compliance. Okay. So to render the quality and the quantity services, all the health and welfare centers should follow or should have the minimum 5 criteria as per the IPHS norms or standards of 2022. The 5 important criteria are, first one is the essential services. So as you know that we have already discussed, there are 2 types of services, that is essential and desirable services. So all the health and welfare institution must provide the essential services, and desirable services, if the state government provide the needed facilities to the health center, they can even render the desirable services. But the essential services are mandatory, and all the health and welfare centers has to render essential quality and quantity services to the public. Then second minimum criteria is infrastructure. So all the health and wellness centers should have the minimum infrastructure as it is mentioned in the IPHS 2022. Okay. Then third is the human resource for health. So to render the services, manpower is required or staff is required. So all the health and wellness centers should have adequate human resources, manpower or staff to render the quality services. So IPHS 2022 is given in detail about the what are the requirement of health personnel or staff is required in different health and wellness centers. Then fourth one is regarding medicines. So all the essential medicines has to be supplied at free of cost through the health and wellness center. That is mentioned under aspects of medicine. So medicine is the another minimum criteria, and last one is equipment. So to render the quality and quantity services from the different health and wellness centers, they should have adequate equipment. So what are the minimum or basic equipment necessary for the health and wellness centers are given in detail in the IPHS criteria or IPHS 2022. So these are the 5 important criteria to have or to fulfill by the health and wellness center to compliance with the IPHS norms and standards. Now section 8 is service provisions. So it is one of the most important section in the IPHS 2022, that is section 8. It includes many things, especially related to the various services provided by the health and wellness centers. So this section includes the detail of the health facilities of the different or various health and wellness centers. So under section 8 service provision, we have 8.1 is infrastructure, 8.2 is human resources for health, 8.3 is medicines, 8.4 is diagnostics, 8.5 is equipment, and 8.6 is quality assurance. Under 8.1 infrastructure, we have 2 areas. One is general appearance and upkeep, and second is other support services. So last video when I discussed about the sub-center, this area was not there in sub-center, but PHC render more services. So in IPHS 2022 for primary health center, we have under infrastructure the second area, that is other support services. Under human resources for health, we have same areas: capacity building or conduct and behavioral standards of the health personnel in the PHC, and safety measures for the health personnel in the PHC. Capacity building is nothing but strengthening the working efficiency of the staff of the primary health center, both in rural and urban area. Then 8.3 includes medicines, 8.4 diagnostics, 8.5 equipment, and 8.6 is quality assurance. We'll discuss later. So under infrastructure, 8.11 is general appearance and upkeep. So it has got 14 different areas of services and infrastructure. First one is maintenance and upkeep of the PHC, both in rural and urban area. Maintenance and upkeep, it includes the signage, posting, etc. Okay. Second one is parking facility. Third one is garden and green areas. Fourth one is environment friendly features such as rainwater harvesting, solar panel system, using CFL bulbs, etc. all comes under environment friendly features. Fifth one is disabled and elderly friendly access. So both the disabled and elderly also has to get the services. For that special preparation is required for the elderly people and the disabled people, that is called disabled and elderly friendly access. Okay. Then sixth one is circulation areas, that is a junction, then corridors, ramps, etc. for the easy transportation. Then seventh one is disaster and emergency preparedness. Then eighth one is fire safety or fireproof. Ninth one is electric power supply. And 10th one is illumination, that is nothing but lighting in the different areas of different section of the PHC. For example, in dressing room, office station. So different the lighting in the PHC. Then 11th one is portable water supply, safe water supply for the public. And 12th one is drainage and sanitation facility, that is closed drainage and other basic sanitation facility. 13th one is waste management, that is both solid waste and liquid waste and even biomedical waste management. Last one is infrastructure for the clinical services, special infrastructure for the rendering quality clinical services, that is 14th point. So we will explain in detail about the infrastructure for the clinical services. So these are the infrastructure comes under general appearance and upkeep of the primary health center. Okay, in the exam point of view, you can just list down all this different infrastructure comes under general appearance and upkeep. So under infrastructure for clinical services, we have 19 different areas of services. First one is outpatient services in the PHC. Second one is screening and holding area. Third one is registration purpose, that is registration room. Fourth one is waiting area for the patients. Then fifth one is consultation rooms. Sixth one is immunization room. Seventh one is counseling room. Eighth one is clinical and central laboratory or clinical lab facilities. Ninth one is medical imaging or radiological imaging sections. Then 10th one is drug dispensing counter or pharmacy, drug dispensing counter. 11th one is dressing room, injection room or emergency room. So dressing room, injection room or emergency room. Then 12th one is minor OT to conduct the minor procedures. 13th one is inpatient ward or day care room. Okay, so we have 2 to 6 or 6 to 10 beds in the PHC. So inpatient ward or day care room facility. Then health and wellness room, that is 14th one, health and wellness room. 15th is labor room complex, that is labor rooms. And 16th one, room for ASHA worker, that is ASHA room. Then 17th one is communication system, that is room for the telecommunication facilities, that is communication system. 18th one is storeroom for the primary health center, and 19th one is other support services. So these are the 19 different infrastructure mentioned in the clinical services of primary health center under IPHS 2022. Other support services includes residential quarters for the staff of the primary health center, dietary services for the patients and others, oxygen support for the patient care, and fourth one is toilet facilities. So it is specifically mentioned that the toilet must be gender sensitive and disabled friendly, functional and clean toilets with the facility of adequate running water and flushing facility. So these are the other support services under infrastructure for clinical services. So next is regarding human resources for health in PHC. So human resources or manpower or the staffing pattern of the PHC. So under service provision in 8.2 mentioned in detail about the human resources of the PHC. Moreover, it is explained in detail in the Annexer 2 of the IPHS 2022 for PHC. Then staffing pattern of PHC, I have been already uploaded a video that explained in detail about the staffing pattern and the functions of the PHC. in depth and in detail as per the IPHS standards 2022 for PHC. So you can refer the video. I will give the link into the description and you can go through that. You can watch and you can understand the staffing pattern or human resource for PHC as per the IPHS 2022. The same thing what has been mentioned or listed under Annexure 2 of the IPHS 2022. Then 8.3 regarding medicines. Okay. So this is an approach to ensuring the access to medicine to the public. Okay. That is as closer to the community. This has been promoted or increased through the policy of essential drug policy. So Government of India is having essential drug policy. Under this policy, every individual or family or community has to have a free access to the medicines as close to their community or village. So through sub-center, through primary health center, the government is issuing or distributing the essential drugs to the community people. Thus, all essential medicines should be available at free of cost in all the health and wellness centers. So Government of India also having another initiative, that is free drugs service initiatives. Under these initiatives, all the essential medicines that must be available or should be available at free of cost without paying any money by the common man or the community people can avail all these essential medicines from the different health and wellness centers. Then in the Annexure 6, it is given in detail about the essential medicines for health wellness center and PHC that is available in all the different categories of primary health centers under IPHS 2022. So this is the common list that is given by the government, that is a list of essential medicines. From this list, each state, okay, every state should identify the type of medicine that is crucial for or critical for their healthcare delivery services, because health problem will be vary from the state to state. So each state has to be identify the different types of medicines required for their service delivery or critical for their service delivery, and they have to ensure that those medicines are available at free of cost in their health care facilities or health centers. Then additional medicines for the management of any locally prevalent or locally endemic diseases also must be there in the PHC based on the local endemic diseases in their jurisdiction or in the particular area. The next is regarding 8.4, that is diagnostics. So in the Annexure 7 of the IPHS 2022 for PHC is mentioned about the free diagnostic test list. Okay, that is given. So all the essential tests being offered at different levels of facilities or different category of primary health center is given or mentioned in the IPHS 2022 for PHC as per the free diagnostic list. Then additional diagnostic test for the management of locally endemic diseases or locally prevalent diseases should be included in the particular PHC. Then moreover, additional diagnostic test based on the locally prevalent diseases or locally endemic diseases also must be available in the PHC. For example, screening test for Kala-Azar in locally endemic areas. Okay, so additional diagnostic test and its access also vary from state to state according to locally endemic diseases prevalent in that particular area. Then 8.5 is explained or mentioned about all the essential equipment. So the equipment mentioned under IPHS should be included in the list of essential equipment at different level of the facility or health and wellness center or different categories of PHC. However, additional equipment, if it is required, that can be procured to provide the full range of services being offered at the facility. That means if any additional equipment is required other than the general list of essential equipment, the government has to be support to or state government has to be provide the additional equipment to the particular PHC, and they have to render the quality services based on the need of the individual family and the community in that particular area. Then Ministry of Health and Family Welfare is having an initiative that is known as Biomedical Equipment Management and Maintenance Program, that is BMMP, Biomedical Equipment Management and Maintenance Program, for the systematic maintenance and monitoring of all the essential equipment in the primary health center or different categories of primary health center. The detailed list of equipment is given or mentioned in the IPHS 2022 for PSC at Annexure 8. Then regarding quality assurance or maintenance of quality assurance is given in detail in 8.6. So quality of care in all its three dimensions. That is quality of care at structure, quality of care at process, and quality of care at outcome. Okay, based on the Donabedian model of quality assurance has been mentioned in detail in IPHS 2022. Okay, so structural quality, process quality, and outcome quality. Everything is mentioned in the IPHS 2022 for PHC based on the Donabedian model of quality assurance. Structure means related to infrastructure quality. Process means related to functions and skill of the staff of the PHC, and outcome is the quality services and patient satisfaction. Okay, this quality assurance is based on the Donabedian model of quality assurance. Then in addition to that, to maintain the quality of care in all the health sectors and health agency in India, Ministry of Health and Family Welfare, Government of India formulated and collaborated with the different international and national agencies for quality assurance. That is international and national accredited agencies. So Ministry of Health and Family Welfare, Government of India formulated and collaborated with the different international and national accredited agencies to maintain the or ensure the quality of health care at district hospital, community health centers, primary health centers, urban primary health centers, health wellness centers, sub-health centers, and urban health and wellness centers. Okay, so international health agencies such as ISQA, that is International Society for Quality in Healthcare. An example for national accredited agency is National Quality Assurance Standards or NQAS. So these all the things are clearly mentioned in the IPHS 2022 for PHC. Then under service provision 8.7 is implementation of IPHS. So implementation of Indian Public Health Standards for PHC. It includes governance. Governance means control. Control is usually done by the state government. Okay. Then second is monitoring. Okay. Monitoring the quality services and functions of the various staffs in the different PHCs. Then Jan Arogya Samiti, that is JAS, Jan Arogya Samiti. So that is acquiring community participation to render the quality health services to the community. That is called Jan Arogya Samiti. Then accountability, maintaining the quality assurance and responsibility to render the quality services. It is explained under accountability. Then patient-centric services or patient-centered services. So giving importance to the patient needs, that is called patient-centered services. That also comes under implementation of IPHS. Then grievances redressal, that is for the reduction of stress and strain among the health personnel or human resources at different categories of PHC. That is grievance redressal for the staff to relieve the stress and strain. Okay. Then information and communication technology, that is to maintain the rapport and maintain the IPR, maintain the public relations, and at the same time for the telecommunication programs. Then intersectoral convergence, that is nothing but intersectoral coordination or collaboration with other health related sectors, that is intersectoral convergence. Then last one is compliance with the statutory norms. So there are different statutory norms or different act or rules and regulations. So the government health centers, for example primary health center, is in compliance with in action with all the statutory norms. They function according to the different act. Okay, so all the statutory act rules and regulation must be strictly adhered to all the health centers and different government health sectors and agencies in India. It includes no objection certificate from the fire authorities, and they should get the in compliance with the state bylaws and the national building code, that is NBC 4, or maintaining the safety of the infrastructure or maintaining all the infrastructure of the different health centers. Then they also should get authorization under revised biomedical waste management 2016, or that is amended in 2018. Okay. Then should follow the seismic safety guidelines. Then health sectors also has to adhere to the Registration of Birth and Death Act, then Consumer Protection Act, Drugs and Cosmetic Act, Indian Nursing Council Act, okay, Pharmacy Act, Medical Termination of Pregnancy Act, Person with a Disability Act, Postnatal Care and Prenatal Diagnostic Test Act, Mental Health Act, etc. So there are various statutory acts are present in our country that to render the comprehensive services or quality services, all the health centers has to be adhered to or strictly abide or follow the all health related act or statutory norms. The next is related to the various annexures of IPHS 2022 for PHC. Annexure 1 is regarding citizens charters. So that is a document or commitment made by the government of India regarding the or in relation or in association with the patient right, okay, for the public or for the citizens. So what are the quality services are available in that particular health centers is mentioned in the citizen charter, okay. And second annexure I have already explained regarding the service delivery framework. It includes what are the different services available at a primary health center, okay, and the staffing pattern of the or human resource of the primary health center also available. Then IPHS 2022 stress the 12 packages of comprehensive primary health care and other services. I have been already uploaded a video of comprehensive primary health care. You can go through that and you will get an understanding about what are the 12 important packages of comprehensive primary health care. So regarding the services and functions of PHC, I have been uploaded a video that is staffing pattern and the functions of PHC. In that I have mentioned in depth and in detail about the functions and services of PHC and staffing pattern as per the IPHS 2022 for PHC. So the link will be given in the description and you can go through that and you can get good information about the functions of PHC and different staffing pattern and services of PHC as per IPHS 2022. Then annexure 3rd is regarding layout, okay, building plan, blueprint of the PHC, 24/7 hours PHC, urban primary center, okay, all given in detail as layout in annexure 3. And annexure 4 is consisted regarding disaster management and preparedness. So various steps in disaster management and various arrangements in the primary health center regarding disaster management and preparedness. Annexure 5 explains in detail and in depth of roles and responsibility of all the staff at or different categories of staff at PHC and urban primary health center. Annexure 6, so annexure 6 we already explained, that is in detail about the list of essential medicines must be available at the primary health center is given in annexure 6. And regarding annexure 7 also we have been just discussed, that is list of essential diagnostic test and equipment. The equipment is necessary for the diagnostic test at PHC is given in annexure 7. And annexure 8 explain about the list of essential equipments must be available in the primary health center. So then annexure 9 is explaining about the cleaning protocol at health and wellness center PHC, urban PHC, 24/7 urban and rural PHC. Annexure 10 is given about the service area wise protocol for the different service area at PHC. Annexure 11 is given checklist for daily rounds in the PHC. So checklist for daily rounds for the supervision of the staff. Then annexure 12 is given about the list of contributors, given different contribution in preparing the IPHS 2022 for PHC. So today I have explained in detail and in depth of IPHS for PHC 2022. Hope this video really benefits in your studies and exams. If you feel it is really worth beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next and important educational video. Thank you.